Hello, this is Mace Hara for the Medical Sales Channel. You have resources in your organization. My question for you is, why aren't you using them? Now you're probably thinking, Mace, resources, what are you talking about? Well, the main thing I'm talking about are people, and specifically people with talents that you might not necessarily have, or whose talents might be better than yours. For example, some salespeople aren't closers. They just can't bring the sale to the close. They do a great job with opening the sale, presenting, handling objections, and then for whatever reason, probably because of a lack of sales training, and if that's the case, you might want to call me, but for whatever reason, they can't close the sale. I'm willing to bet that you have people in your organization that can close the sale. Let's say a VP of sales, for example. VPs of sales oftentimes have the power to make changes or to satisfy conditions that make the sale possible, something that you can't do unless you go to the VP, and then you're sort of the middleman and you're going back and forth. What if you brought the VP of sales into the sale? You see, there's no crime in utilizing resources. There is a crime when you're unable to do it by yourself and you don't ask for help. It's no shame to need help from time to time. In fact, when you find people who could do things that you can't do and you recruit them for your purposes, that is a sign of strength. Now, the reason I'm sharing this with you, my medical sales professional friends, is that medical sales is oftentimes a very egoic undertaking. We have egos, or we couldn't do this. We want to close the sale on our own. And if we can't, we don't want to let anybody know. But guess what? Your sales managers know. People in the company know when they look at your sales numbers and you're not performing the way you're expected. So if the alternative is to bring in some of the resources, the people in your company who know how to close the sale, then by all means do it. Remember, getting help is not a sign of weakness. It's actually a sign of strength, because one of the best strengths you can have is knowing the skills and the strengths that you lack. Because when you know that, then you could find them, and you'll close more sales. And by the way, you get the commission check. How cool is that? For the Medical Sales Channel, this is Mace Hara.